Hello, my name is Jocelyn Warfield, and I'm a nurse practitioner. How are you today?
I'm good. How are you?
So you're here for a physical exam?
Yes.
Okay. Is it okay if I do your physical exam for you today?
Yes.
Okay. Your first and last name?
Ryan Foster.
Okay. And your date of birth?
07/06/96.
And what's today's date?
12/10/21.
Perfect. Let me just sanitize my hands. Okay, so our tech got your vitals. They were perfect. Also got your weight. Everything looks great. So we're going to start with your head. So I'm just visualizing it. I see no lesions, no lumps. I see you have full head of hair. It's shiny, no dryness. Doesn't appear to have any lice. Have you had any issues with your hair lately? No. Okay, so I'm going to get started. And the first thing I'm going to do is begin by palpating your head. Just feeling for any lesions, any lumps, any pain?
No.
Okay. Moving right along, I'm going to palpate your temporal artery. Any headache, any dizziness?
No.
Okay. Pounding pulses bilaterally. Also, while we're here, I'm going to ask that you open and close your jaw. All right. There's no clicking felt. Also, I'm going to palpate your ears, any drainage, any pain, any earaches?
No.
Okay, great. And I'm also feeling the mastoid, palpating the mastoid process as well. Okay. All right, so we're going to start. I'm going to ask that you cover your right ear, and then we're going to complete the whisper test. And just repeat what I'm saying to you.
1, 2.
All right, and then the opposite side.
A, B, C.
Perfect. I'm going to take a look in your ears first. All right, the membrane is pearly and white. Okay. Pearly and white. Okay, so any issues with any visual issues?
No.
Okay, when was your last eye appointment?
About 3 months ago.
Okay, so can you open and close your eyes for me? Great. And I see your eyebrows are symmetric. That's great. I am going to take the pen light and assess your pupils. I'm going to ask that you just follow the pen with your eyes. Okay. Intact. Okay. Then we are going to assess. I'm going to ask that you close your eyes, and I'm going to place something in front of your nose, and you just tell me what you smell. Okay, you can open them.
A banana.
Perfect. And then we are going to look at the Snellen chart that we have here behind us. Could you read the lowest line, and could you cover your right eye, please?
YMB 34L.
Okay, and then the next, thank you.
YMB 34L.
Okay, patient appears to have 20/20 vision. Okay, so then we're going to go to the neck, and I see that her trachea is midline. Also, I'm going to, while I have her, she would be at a 45-degree angle. I currently see no JVD on this side. And the same for this side. I'm going to come behind and I'm going to palpate her glands, thyroid glands. Okay. Then I'm going to take my stethoscope, and with the bell of the stethoscope, I'm going to listen to the carotid artery. Could you hold your breath for me? Thank you. Okay. Then I'm also going to fill the carotid one at a time. Let's do. Any issue swallowing?
No.
Okay, perfect. All right, so also I'm going to have you shrug your shoulders, and I'm going to, I'm going to push down on them. Okay, great. And tap. Okay, next, so we're going to assess the chest. I'm going to start with lung sounds. I'm going to be using the diaphragm. And also I will be auscultating underneath the patient's clothes. But for this purpose, I'm going to go on top. I'm going to ask you to breathe in and breathe out, okay? No. Breathe in. Breathe in. Okay, no. Lungs are clear, and no adventitious sounds heard. And I'm going to do the same for the back. And like I said, I would normally auscultate underneath the patient's clothing. Clear lungs heard anterior, in the anterior and posterior. So now I'm going to go, so do you do breast exams at home?
Yes.
Okay, how often do you do them?
Once a month.
Okay, and you typically do them at the beginning of the month?
Yes.
At the same time? Okay. And when you're doing it, are you standing in front of a mirror? And then also, you can do it in the shower as well, and you're palpating and feeling for any lumps. Have you seen any changes?
No.
Or felt any changes?
No.
Okay. So for this purpose, I am not going to examine her breast, but I would have looked at the areola to see if there was any dimpling. Also, I would be palpating for any masses and making sure that she's not in any pain. And also, I would educate the patient on the importance of a breast exam since she is a female. So now I'm going to auscultate the the heart sounds. Okay. So starting at the aortic. And I as well, I would be auscultating these sounds underneath the patient's clothing, but for this purpose, I went on top. Regular heart sounds auscultated S1, S2, no gallops. Also, I'm going to use the bell to listen for any murmurs. No murmurs, auscultated. Have you had any chest pain?
No.
Any palpitations?
No.
Okay. Right now, I'm also going to be looking at her hands, looking at her cap refill. It is less than 3 seconds. She appears to have no edema. I'm also going to feel her radial pulses. Okay. +2, +2, and then compare. +2. Also, I'm going to feel her brachial pulses. There we go, thank you. +2, +2, compare, +2. Okay. I also would have listened at the mitral valve, or at the apex of the heart, for a full minute to get her heart rate and to make sure it was normal. Moving right along, we are going to be going to GI. When was your last bowel movement?
Yesterday.
Okay, have you had any burning or any issues eating different types of foods?
No.
Okay, so I'm going to auscultate her stomach. I'm starting in the right upper quadrant, going in a clockwise direction. I would also auscultate underneath her clothing, but for this purpose, I will not. Hypoactive bowel sounds, I'm also going to palpate her stomach as well. I'm going to do a light palpation and then go into a deeper palpation. Let me know if you're feeling any pain. Okay, now deeper. Belly seems to be soft, non-tender. She has hyperactive bowel sounds. No issues there. Also, I would be doing the McMurray's test. I would have her lay down while I complete this exam, and I would hook my fingers up here and then release them to see if there's any rebound. And then also I would do it to the left upper quadrant as well. And here I would be feeling if there's any, if her spleen was enlarged, which it is not. Going to GU, have you had any issues voiding? Are you drinking, are you staying hydrated and voiding appropriately?
Yes.
No burning?
No.
No discharge, no vaginal discharge?
No.
No itching? When was the last time that you've been tested for STDs?
A couple months ago.
Okay, if you would like, we have that service here. You can have that done. So, I would, for this purpose, I'm not going to do a, like a vaginal exam, but if need be, I would have, but for this purpose, we won't do that. Also, I would feel for her femoral pulses as well. For this video, I will not do that as well. When was your last menstrual period?
2 weeks ago.
Okay, are they pretty regular?
Yes.
Okay, and have you had a pap smear in the last 3 years?
Yes.
Okay, awesome. Now going to musculoskeletal, I'm going to have you also raise your arms like you're holding a pizza, and I'm going to press down, and you're going to press up. Okay, good. I'm going to ask that you squeeze both of my hands equal. Great. And then I'm going to also ask that you press your feet down like you're driving and then pull them back. Great. Also, while we're here, I'm going to feel for your pulses. I am feeling for the popliteal pulses. I would do this underneath her clothing as well. So I would feel on this side, then this side, then I would compare as well. And then on her feet, feel for the dorsalis pedis pulses and the posterior tibial pulses as well. And then I would do one at a time, then compare. Any numbness or any tingling in your legs, in your arms, anywhere?
No.
No. And are you exercising regularly?
Yes.
Okay. Have you had any issues with any pain in your legs, in your arms?
No.
Okay, great. No troubles walking?
No.
Or anything? Okay, perfect. Also, I would feel for I'm doing the cap refill in her toes as well, and those are less than 3 seconds. So we're going to move to your mental part of your exam, and first I'm going to give you three word phrases, and then I'm going to ask you in a few minutes to repeat them again. So white car, black dog, red ball. Okay. Could you repeat those for me?
White car, black dog, red ball.
Perfect. So if a cat was chasing a mouse, which animal would be caught?
The mouse.
Correct. Could you repeat after me? No if, ands, or buts.
No if, ands, or but.
Perfect. I'm also going to give you a piece of paper, and I'm going to ask that you just read this for me.
Merry Christmas to you.
Perfect. And then I'm going to give you a pen here, and I'm going to ask that you write. Today is Saturday. Perfect. Could you repeat those 3 phases for me, please?
White car, black dog, red ball.
Have you had any issues with memorization lately?
No.
Okay. And how has your mental been? Have you had any stressors lately?
No recent stressors.
Okay. Are you getting adequate amount of sleep?
Yes.
Okay. And any questions for me?
No.
Okay. Well, it was a pleasure doing your head to toe assessment, and we'll see you next year.
Thank you.
You're welcome.